Hello, 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 everybody, and welcome back to the IBS Freedom Podcast. As you can see, if you're on YouTube, you can see that we have a guest with us today, and I'm so pumped. I am not only joined by Amy Hollenkamp, RD to the max, but we also have Dr. Jennifer Franklin. She is a psychologist who's actually local to me. We have met in person, which is kind of rare in this day and age of podcasting and such. But she is a psychologist who practices in Durham, North Carolina, so one town over from me here in Chapel Hill. And let me tell you, she's rad, folks. I'm so excited to have her. I actually met her via a patient, and I took a class with her that was for professionals a few years ago, and it just rocked my world and blew my socks off. We're going to talk about the vagus nerve. We're going to talk about something called Polyvagal Theory, the mind-body connection, the gut-brain connection. It's going to be so fun. And one of the things that I think makes Dr. Franklin really stand out in the space is that she herself had IBS, and then she went on to heal her gut and recover from that. And now she has spent the last, 20 or so years, right? Practicing and helping people with GI disorders like IBS and IBD and cyclic vomiting and chronic constipation. So she really blends personal experience with clinical experience and just a really great lens to view the body. So without further ado, I'll put a plug in really quickly. We're going to talk a little bit later about the fact that Dr. Franklin is launching a webinar series, or right now actually has a webinar series on her website. So if you want to check that out, her URL is fantastic. It is don'thateyourguts.com. And I believe your YouTube channel is under the same name, if I'm not mistaken. Correct, Dr. Franklin?
Yes. Everything lives at don'thateyourguts.com.
Perfect. Love the URL. Love her. And welcome, welcome. So where do we begin?
First of all, I just want to say thank you for that introduction, and thank you for having me here. I'm really excited to be here, and it's really nice to meet Amy for the first time, and I'm really excited. Thank you.
Yeah, absolutely. So let's, if I may, maybe let's start off with a little bit of comparison and contrasting and kind of framing the conversation as, you know, we frequently talk on this podcast about like the conventional, typically reductionistic approach to health, especially gut health, where it's like, oh, you just label the dysfunction, you maybe band-aid it with a medication or a surgery, and then you move on with your life. Versus a more holistic, total body approach to healing. Like, do you want to weigh in on that for starters? And that'll maybe frame our conversation.
Sure. I could say a lot about this because my training from the get-go was really very mind-body oriented. So I don't really know any other way to come at psychology other than a mind-body approach. I think I would just say that, understanding IBS and a lot of these gut problems is not just a function of understanding the gut, right? We know now that there's a gut-brain connection, and it's not really, I don't even really like gut-brain necessarily talk, because your brain is really connected to a whole nervous system, right? It's part of your nervous system. And so I really talk in nervous system terms as opposed to just brain terms, because you have a nervous system that's wired all over your body, including in the gut. So you also have an immune system in your gut, right? So your gut is really a hotbed of activity. You also have a whole microbiome in your gut. So, we can't really talk about gut problems without talking about a whole lot of other things that are going on. And every day we're learning more about the complexity of the gut and how it works. So I think we really have to think outside of just digestion when we're talking about healing gut problems.
Yeah. And I think Amy will probably concur, but that's something we talk about on this podcast a lot is like, in the IBS and the SIBO space, I think a lot of people are, even in the more holistic natural setting, they're talking about probiotics and prebiotics and antimicrobial herbs to like kill the yeast, kill the bacteria, kill the parasites, but they're not always branching out and thinking about the immune system, the nervous system, blood
Right.
flow, anemia,
Right.
nutritional deficiencies, etc. Right?
Right.
Yeah, and I'll add too, I find in the functional medicine space, even outside of gut related issues, so even outside of IBS, I think there's this mentality of if you can manipulate the microbiome, you can like repair the brain gut axis, or like all these other problems will go away. We just need to fix the gut. When I think in a lot of ways it's the opposite. Like if you can support the nervous system, support hormones, support the immune system, and along with supporting the microbiome, then you can see relief from a gut standpoint, but also maybe some other systemic things. But I do find, in the functional space, there's this over reliance on manipulating the microbiome and not seeing other things. That's a little bit problematic for sure.
I think that's Western medicine. I think
right.
I think the focus is on manipulating whatever the sexy topic is at hand, and right now it's the microbiome. Before it was, using antidepressants to affect the chemicals in the gut, serotonin and other neurotransmitters, and so whatever the sexy thing is that they've learned is an important variable in this equation. They're trying to manipulate. And, as a psychologist, my domain is the nervous system. So I guess you could say I'm working on manipulating the nervous system, but it doesn't feel very manipulative because it's really coming from a place of understanding and compassion as opposed to just kind of targeting this one thing and pushing this button repeatedly. Does that make sense?
Yeah. Well, it's maybe less about forcing the body to bend to your will and more about listening to what it needs, right? Like
Absolutely. That's what it's about. And in fact, I think one of the most important points I can make to your audience here today is that we don't consciously control our digestion. As much as we would like to in order to be able to fix our digestive problems, we don't consciously control digestion. So we have to get a little more sophisticated in how we approach healing.
Well, I disagree because I have the ability to just think, okay, bile right now. and enzymes, ready, go. And I've gotten very good at that. So we'll talk for you normal folk, but just so you know, I'm very skilled. So
you have superpowers.
Yes.
I know. Yeah. And all of that can be yours if you follow my Instagram account.
Oh my gosh.
But seriously, you're right. Like all of the stuff that I think we're going to talk about today, we have this bias of thinking of the brain, and we're really thinking about the cortex, right? Like the frontal lobes and the part of the brain that does like the super smarty pants thinking. But there are other parts of the brain, like the autonomic nervous system and the limbic system, that are controlling the body and the bodily functions behind behind kind of a closed curtain.
Right.
And A, we're fairly unaware of it on a conscious level, and B, we have no control over it.
Right.
So you can't force your vagus nerve to work better. You can't will your vagus nerve into doing its job. You have to create an environment and create connections so that the vagus nerve feels like it can do its job. I don't know.
That's right. That's right. It's all about setting up the conditions under which your body can heal, and then taking some action steps, and some are more passive and some are more active, but taking some kind of action step that would actually promote healing under those conditions.
Mm-hmm. Yeah. And to that effect, that might segue beautifully into the topic of the vagus nerve specifically. So probably a lot of our listeners are at least moderately aware of what the vagus nerve is. It's the cranial nerve that connects your nervous system, your brain, to your gut. And it controls everything from motility, acid secretion, enzyme secretion, bile flow. It regulates and dampens inflammation. It's a pretty freaking cool nerve. And it's really, really important, especially to those with problems basically from the throat to the colon. If you have problems between the throat and the colon, the vagus nerve is a relevant topic for you. But I really liked how you explained that. When I took your class for professionals a while back, I really, really liked how you talked about the vagus nerve. And you were actually the first person to introduce me to the concept of polyvagal theory. So could you like talk a little bit about that? Because I thought that that was just a really great lens to view the vagus nerve, and then we'll kind of compare and contrast that to some other rumors on the street that have to do with the vagus nerve.
Perfect. Well, first of all, I want to just, before I even talk about polyvagal theory, I just want to say that polyvagal theory was the first time that I really came to have words to articulate the healing that I had experienced in my own life with respect to my IBS that I was diagnosed with many, many years ago. You know, I knew the process that I went through to heal, and I was trying to articulate it, but polyvagal theory really gave me a framework for understanding what had happened to me and how to talk about it with others. So I'm very grateful to Stephen Porges for bringing this to light and putting words to what our bodies do in certain ways. So Stephen Porges calls polyvagal theory, and he's the creator of polyvagal theory, or the theorist that came up with polyvagal theory, and he calls it the science of safety. And polyvagal theory, poly meaning many, right? So polyvagal is basically the idea that your vagus nerve is comprised of not just one thing, but it's actually a bundle of nerves that has two branches. And these two branches, they work very much together, but they also connect to different parts of the body. And so therefore they work in slightly different ways. And so when we talk about a lot of people understand the nervous system in very simple terms. You know, you turn on the sympathetic nervous system, or you activate the sympathetic nervous system, and that's the body's gas pedal. And then in opposition, you have the parasympathetic nervous system, which is the body's brake pedal. And those two things just kind of work in opposition constantly. And polyvagal theory really adds a layer of sophistication and complexity to that model, which I think is probably more accurate in a lot of ways. Because it's not as simple as we just have a parasympathetic nervous system, right? The bulk of our parasympathetic nervous system lives on our vagus nerve, right? And that vagus nerve has two branches. So these two branches have a lot to do with what the parasympathetic nervous system is doing, and they don't always work together, right? Sometimes one is doing one thing and one is doing something a little bit different, and then that affects overall what the parasympathetic nervous system is doing. Does that make sense?
Yeah, I think so. And I remember this too from your class, and tell me how this ties in. And I feel like I'm asking the teacher to give me a refresher like 2 years after I took the class, like, hey, professor. But I remember a discussion too about this idea of the window of tolerance. And I remember you have a good blog post on your website about this too, because I've sent that link to so many of my patients over the years. And I remember that concept of a window of tolerance for stressors, and the idea that you can be, and you're probably going to explain this way better because this is my understanding of it, but you can be more hypo-reactive or hyper-reactive in like a stress situation. Do you think I did that justice at all? And if not, please.
It's a little more complicated. So yes, you're doing it justice just fine. But it's like the way that I talk about this in the webinar series that I've just launched is in layers, because polyvagal theory is actually quite complicated. It took me several rounds of being exposed to it and being educated by people who really know how to explain it to really get it. So forgive me if it's difficult to explain or difficult to understand. Okay, so the window of tolerance is a concept coined by Daniel Siegel, who's a neurobiologist, a wonderful neurobiologist out of UCLA. And the window of tolerance is basically this idea that we have a certain capacity to handle stimulation, to handle stress, to handle excitement, to handle all of the things that stimulate the sympathetic nervous system or turn on the parasympathetic nervous system, right? So everything that gets our autonomic nervous system working, basically, and is manageable. Whatever is manageable to us, that's turning on the autonomic nervous system or working on the autonomic nervous system, is referred to as the window of tolerance, right? So as much stress as we can handle without becoming overwhelmed, without having symptoms like anxiety or certainly a lot of gut problems, right? So in other words, gut problems are explained through this particular lens as a very dysregulated autonomic nervous system. Does that make sense?
Yeah.
And so the term hyper, I think what you were getting at, Nikki, is hyperarousal and hypoarousal are terms to describe the two directions that dysregulation can go.
Yes. Yeah, and that's kind of the visual I have in my head too. I remember you have a picture in your blog post, and I think you showed it in the class too, where it's like, if you imagine like your computer screen or a piece of paper, it's like maybe the middle third of that page is the window of tolerance. And if you stray outside of, to the upper third or the bottom third of the page, then that would manifest as potentially symptoms, anxiety, depression, gut issues. But yeah, it's that idea that like some people will manifest stress as being like in that hyperarousal state and manifesting things, I would assume more along the lines of like outbursts or like outward shows of anger or frustration, versus some people, when they become dysregulated, will swing the other way and, they might clam up. They might drop off the radar and not communicate with people or not be able to perform at their job, or they might need a lot of extra sleep and kind of go off the grid. And that was really profound for me because I think that hyper arousal states of dysregulation seem like they're more prominent in like TV and movies and society. Like I think we all have that image of like the person who was really stressed and then they had an outburst and they had to go to anger management class or whatever. And then that's never been my MO. For me, when I'm stressed or overwhelmed, I drop off the radar. I neglect my emails. I neglect my text messages. I kind of clam up and don't want to do things. So it was eye-opening for me because I never really saw that as a symptom of dysregulation.
Right.
Until you pointed that out in the class, and I was like, oh, okay, it's like two sides of the same coin almost. Right? It's just like which way you swing when you are dysregulated. Yeah. Yeah. I think
what I find is more helpful is by looking at it through this lens that I'm talking about, or that we're talking about right now, is that you can see a whole lot of different symptoms, more psychiatric symptoms or psychological symptoms, and also gut symptoms and other physiological symptoms as a manifestation of a larger problem, right? That really, I think we could say that IBS is a symptom of nervous system dysregulation for a lot of people. Is that always the case? I don't want to go on the record and say that that's the case 100% across the board, because everybody's situation is a little bit different. This is a very, the approach I take is a very individualized, tailored approach. It is not a one-size-fits-all approach in any way, shape, or form. But I do think that probably most people with medically unexplained digestive problems that are diagnosed as IBS and chronic constipation, whatever else, the whole litany of diagnoses, that there is a nervous system dysregulation piece that goes hand in hand with that and often precedes the acute IBS or digestive symptoms. And, the problem, other than the actual IBS and the symptoms that go along with it and all of the other, things that go along with it, like, the avoidance strategy and the fear and all the emotional reactions that are very normal that go along with IBS and other digestive problems, is that a lot of people with these kinds of problems don't recognize that there is stuff brewing in their nervous system. There is a level of dysregulation that's been there for a long time. And when something's been there for a long time, or it's developed over a long time, it's really hard to see, because it's kind of just all or it's
right.
happens so gradually, so incrementally over time, and the other complicating factor is that our bodies naturally adapt to things. We make do. We
survive.
Cope. We cope. Our bodies are designed to survive. And so we're surviving our own, level of dysregulation so the only way to recognize dysregulation is through regulation, right? Like when we have a well-functioning, a really healthy autonomic nervous system that has a window of tolerance, it can handle some degree of stress without becoming overwhelmed. We have resilience, right? We have flexibility, psychological flexibility. We can roll with life's ups and downs, and we don't get stuck in these eddies of, stress or trauma or whatever. Then, by getting better regulated, it's only by getting better regulated sometimes that we can actually see what things were like before.
Yeah. Well, and I have a comment too. It's interesting that you're talking about almost like a reference point. Like if you've always been dysregulated, you don't really necessarily remember a reference point of when you were regulated. And I know Nikki and I have talked about this, where we've had patients, clients that we've worked with that have been like, oh, I'm not stressed, or like rate their stress low, and like just talking to the person, you're like, whoa, like they're definitely stressed.
Right.
You can tell there's a level of stress there. And so I do think you're 100% accurate that sometimes it's just like so over your head. Do you feel like in those particular cases, I mean, I'm sure if the patients that you're getting kind of want your approach and maybe they've seen that they're dysregulated, do you have any like potential ideas on how to like approach someone that is stressed, like as a clinician and maybe even a friend or something, if you're seeing someone sort of more in a dysregulated state, like how the best way to approach that would be?
Well, yes, there are some things that's basically the large majority of what I'm doing when I'm working with people. It's like helping to figure out what is going to give that person the biggest bang for their buck, right? Like what is going to make the biggest difference for that particular individual, right? Because everybody's a little bit different. I mean, you can think about love languages, right? Like you can do something that you think, is a way that you would feel really cared for, right? That might make you feel good in a certain moment when you're not feeling so good. And that might not mean anything to somebody else.
Yeah, for sure. Yeah.
And I'm just reaching over here because my power is very quickly dwindling. So I'm having to make a little adjustment here. Hopefully this won't create.
We live in the modern
much of
world.
a problem.
It's all good.
I will say too, like I like that you're bringing up that, everyone has a different need that's gonna get them to their to their more regulated state. And I like that. And I think like as a clinician and working with people, I feel like I've gotten more to that point. I think in the past I've maybe given limited options, but for me, what I've sort of tried to help people do is ask themselves each day, like, what do you feel like you need or want? Just to give them a sense of maybe something they're missing. Sometimes I'll even ask them, like, are there things you don't want to do? And even analyzing that list can be interesting because a lot of times some of the things that they typically don't mind doing, they're like dreading. Like going to the grocery store or something like that. You know what I mean?
So I think part of what I'll be talking about in my webinar series is the different parts of the autonomic nervous system and what they do and how they work together. Right. And it's really important to understand that because the bottom line is that there's a branch of the vagus nerve called the ventral vagal system. And that is the part of our autonomic nervous system, which is really about connection, right? And it's through connection that we survive as human beings, right? Babies die if they're not connected to adults who are able to provide for them.
Right.
Right. And so, connection is really central to developing a healthy nervous system. That's how our nervous system first learns how to do regulation. It's through connection with calm, caring, present, warm caregivers. And so if we just apply that, I mean, really simple terms, if we just try to approach the people in our lives that have digestive problems that they're struggling with from a place of, how would I behave towards an infant, right? Just an innocent little baby that's just come into this world, right? Like with that kind of care and warmth and, not necessarily in our language, right? If we're talking to an adult, we need to talk adult talk, but in, right? But like in spirit, just really cultivating that atmosphere within ourselves and transmitting that to the people we care about, just one of utter compassion. And that also is what people with digestive problems need to sometimes learn to be able to better do for themselves, right? We also want to help people with digestive problems to cultivate that kind of care, right? In Buddhist practices, we call this loving kindness, right? Or metta. It's that love, that just unconditional love that we, that a mother or a parent would have towards their child, right? And so we really want to treat our bellies and relate to our bellies. And really, it's bigger than that. It's our whole bodies, right? It's all the parts of ourselves, all of them, right? Even the parts that we don't like so much or that we try to keep in the shadows of our psyche. But really trying to exercise and cultivate and exercise that level of compassion, right? And kindness and acceptance.
I love that. And I love that you brought up kind of the two elements of that, that you want to have compassion and warmth and understanding internally, like
towards ourselves,
for your own body, for your own self.
And all the parts, right? Like all the parts.
Yeah.
All of them, the physical parts, the emotional parts, the mental parts, like all of them, everything. Yeah.
I like that. And I think I might have mentioned this to you on a podcast episode, Amy. I saw something not that long ago, and it was a meme or, some internet-y thing. And it said, look at your internal self-talk and like how hard you are on yourself, and think if somebody said that to your child or your dog, like what would your reaction be? And if you think of like the stereotypical stuff that a lot of us tell ourselves, like, oh, you look really pudgy today, or like, oh, you shouldn't wear that looks horrible on you, or oh, I don't know, like, I hate X. Like, if somebody told my 5-year-old daughter that some of that negative self-talk stuff, like if they verbalized that out loud to her, I would want to punch them in the face immediately. So like, of course, having that same internal dialogue for yourself is just not conducive to healing. But I liked that way of looking at it. Like, what if somebody told that to your kid or your pet? And it kind of, I think it helps people go, oh, that is super not okay to say, even to myself. But similarly, like, look at the environment around you. And I'll say, just like clinically, I have some questions on my intake forms for new patients where I ask about, like, are your family members or your spouse or whoever you live with, are they like on board with like what you're about to embark on? Like, are the cooks of the house willing to make some modifications if you need to eat differently and like modify your diet? Like, is your spouse on board with you like seeking care at this office? And I ask questions about support systems and like, friends and family and who you have the most support from. And it's really, really telling. And I think it correlates that the people who have the best support systems at home and like people who are just more empathetic and understanding that are supporting them, I think that's more conducive to healing, as opposed to somebody who says, no, like I'm on my own, my husband's totally not supportive, or my wife is totally not into this stuff, and they think I should just be on an antidepressant and be done with it, or whatever it might be. When I see that kind of pattern, like the not very supportive or understanding people in their immediate environment versus the people who tell me, oh, my kids are super supportive, like my spouse is all in, like I have the support I need at home, absolutely anything, we're going to make it happen. Like those are very different scenarios. But I think it goes back to your nervous system and your vagus nerve need that love and compassion and support and warmth in order to facilitate its healing. So
yes, absolutely. I agree with everything you're saying. And as you were saying it, there's another element that comes to mind that I didn't mention yet, which is that, I have a feeling, first of all, my power is quickly dwindling, even though I'm plugged in. So I'm really worried that my computer is just going to shut down at some point here. Yeah.
Hi, everybody, and welcome back. We had some power issues with the laptop, but we are back for part 2. So, Dr. Franklin, I think you were just saying that we were talking about having compassion and, well, you take it away, because I don't need to repeat what we've already covered, I suppose.
One thing that I want to add to what we're talking about is that the ventral vagal system, right, is very responsive to pleasure, right? In fact, the whole vagus nerve is very responsive to pleasure, right? So how this gets a little complicated is you can be, as a healthcare provider working with people with digestive problems, or as somebody who's, a significant other or a relative of somebody with digestive problems. You can be kind and compassionate and caring. You can do all the right things, and yet it might not really translate to a difference in terms of how they're feeling. And that gets complicated, because when you're used to feeling bad all the time, your orientation becomes focused on the bad, right? And we also have to think about how our autonomic nervous system is responsive to stressors. So having IBS and all the symptoms that go along with it involves a lot of stressors, basically. So we're being stressed by stressors that are actually happening within our own body, right? And that then narrows our thinking, right? It alters, right? Stress alters the way that we perceive, the way that we react, the way that we think. It shuts down a lot of different functions, including mindfulness, right? Big picture thinking is really hard because our mind gets very myopically focused on the problem, because our brains are designed to troubleshoot problems so that we no longer have these threats in our environment, whether it's your internal environment or external environment. And then we can go back to being at peace once that situation or stressor or threat is resolved, goes away, right? Or killed or escaped from, right? Mm-hmm. Yeah. So in the case of living with an ongoing chronic physiological problem, be it digestive or some other problem, that then becomes very tricky, right? So you've got all the right conditions, you've got a caring environment, you've got caring people who want to support you, they're listening, they're doing all the things. And sometimes that's not enough because there's now a pattern in place in the person with the digestive problem's body that is making it very hard for them to unhook from this very, kind of limited way of perceiving and thinking. And it's very focused on, it's a stress response. It's a stress response, and it's, it can be very prolonged, and we can get stuck there. And that's basically dysregulation, right? When we talk about getting stuck, there's not movement, there's not ebb and flow. We get stressed, and then we come back down and get settled and calm and relaxed again. Everything's fine. Everything's at peace, right? We have ease again. And that's what we want to see, that there's movement. There's stress, and then something gets resolved, and there's, and we talk, when you see a regulation line drawn in a diagram of the window of tolerance, you'll see a very wavy line. Or another way, I have a little tool for those of you who are watching, it's, and I think I showed you this in the seminar that you attended, right? We want to see movement. We want to see stress, and we want to see expansion. We want to see, contraction happens when we get stressed, and then there's expansion as things get resolved, and we come back to peace and ease, and our body recovers from the effects of stress, and then stress, and we start moving back. And there's a lot of different dynamics that go along with this whole mechanism that underlies the way our autonomic nervous system works. And what happens for somebody, even given the right conditions, is that we get locked into focusing on fixing the problem. The problem doesn't feel good. Our focus is on all the things that don't feel good for the sake of trying to fix it. It's like a benign intention. We want to fix it, but nonetheless, we're focused on the things that don't feel good. Yeah. So one of the things that I do, that's really important in my practice and my work with patients is, and I know this sounds crazy, but it's really focusing right away as quickly as possible. I mean, I find ways to do this in the very first session when I meet somebody. Like, what can I do to help you feel good right here, right now? And we're not talking amazing. We're not talking perfect. We're not talking about getting rid of the problem. We're not stopping, we're not stopping the problem from ever happening again. That's not going to happen today, instantly, right? But how can we focus on something, anything, that's going to help you to feel some degree more of pleasure, to feel better, good, right? Like a moment of reprieve, a moment of relief. And then all we want to do is just really milk that moment, right? Like bring our attention to it, work with some mindfulness skills. Because once we start feeling that way, mindfulness becomes a little more possible, right? When we feel better, there's a little more expansion in the mind, in the body, in the heart, and we can actually breathe again a little bit better, and we can focus our mind a little bit better. We feel a little more hopeful, like, oh, this feels really good. But so it's a lot of things that go along with that, right? It's right brain experiencing, which is feeling, sensing, being in, being with. It's not thinking, analyzing, trying to solve problems. It's not that kind of thinking. It's just being in the moment with something that feels good, slowing down, enjoying it, which, it's a lot of attention skills. It's a lot of mindfulness skills. Like people who are doing mindfulness to treat IBS and other digestive functions, that helps to cultivate these skills. But mindfulness practices, just mindfulness practices without some of these other elements I'm talking about might not be that helpful, right? You can sit in meditation by yourself, but there's no connection with other in that situation. There's no talking, relating, listening in that scenario. It's just you in silence, meditating with guidance or without guidance. But I think it's a very solitary experience a lot of times, and you might feel more connected to yourself, but we also, that might not be enough to really make a difference. And in terms of the long-term treatment picture, you may need to do other things besides just sit in meditation.
It's interesting they bring this up today, even because I was talking with a friend via Marco Polo, which is an app where you can do videos back and forth to each other. And she was saying that she had just like kind of a wave of, I think she described it as depression. Just like she just cried out of the blue, sobbing. And then she got kind of a crappy night of sleep. And then she was like, but now the last day or two, I'm okay. I don't know what to make of it. She was like, well, I'll have to process that with my therapist in therapy this week. And she was saying one of her hypotheses, she said, well, one thing is I've been really busy and I haven't made the time for reading. And like she had told me a while back that reading is her thing. Like she doesn't really watch TV or do movies, but she will just read to her little heart's content. She'll read like 1 or 2 books every single week. And she was saying that that's like her escape. Like she gets in the zone and she could just get lost in a book. And she described it in a way that sounded reminiscent to when people talk about meditation and they like get really deep into the zen of meditation. And I just had her a message this morning. I was like, well, I think reading might be like your version of meditation. Like you want that grounding and that experience, and like it helps you kind of regulate, and you need to have like a dose of that in your life. And there had been a couple of days where she didn't make time for herself to enjoy reading. And I was thinking about, for me, I was like, well, for me, I think being outside, I can get to that kind of state of just total calm and comfort and happiness. Like you plop me in front of a couple of trees or a river or a creek or a pond and I'm good to go. Or doing like arts and crafts and painting or drawing, I think I could get to a similar kind of zen feeling. But anyway, it's interesting that you bring that up because that kind of reminded me of my conversation with Kara this week. So,
yeah, I would agree that lots of things can be mindful, whether you're sitting in meditation, whether you're walking. Conversations can be mindful. I mean, there's a lot of ways to practice being mindful. Mm-hmm. We can bring the qualities of mindfulness to a lot of things that we do. And a lot of things can be mindfulness practices for people. Yeah. And I think there is an important distinction to make though, because if you're starting from a dysregulated autonomic nervous system to begin with, right? So you're talking about a nervous system. See, this gets into a little more of kind of the education around regulation, dysregulation. But basically, when we're talking about a well-regulated nervous system, we're talking about a nervous system that is self-regulated, right? Your body knows how to do regulation. It knows how to get stressed when it needs to, and it knows how to recover. And for you to return to a state of ease and peace, and there's resilience in the system because you have a functioning window of tolerance. Mm-hmm. And a dysregulated nervous system and therefore body is not one that is moving, right? It's stuck. Right? It's not able to flow as well with life's ups and downs. And, we're talking about these we're talking about regulation in kind of discrete terms, but there's degrees of this, right? There's, sometimes we have some capacity, but not enough to deal with this, like trauma is a perfect example. Something that's traumatic automatically gets us dysregulated. That's the very nature of the definition of trauma, right? It's too much. It's something's too overwhelming. It's not something that's ordinary that we can flow with easily, right? So it just bumps us out of our window of tolerance and makes it so that our bodies can't come back to a regulated state, right? So they get stuck in a dysregulated state. And self-regulation or having a well-regulated nervous system and body is something we learn how to do over time. It starts when we're babies. It starts through attachment and through the connection, the relationships that we have with our caregivers. That's the very earliest beginnings of how a regulated nervous system begins to happen. And similarly, when we get dysregulated as adults, that automatically means our nervous system is not able to regulate itself anymore. And therefore, we need other people to help our bodies to get back into a state of regulation. And if we've never really known what regulation feels like to begin with, then that's kind of what needs to happen, right? We need other people who have well-regulated systems to be present for us and to relate to us and to help our bodies, our nervous systems, to have a felt sense. Do you know what I mean by that? Mm. Yeah, to feel, like for us to actually have a visceral experience in our own bodies of regulation through somebody else's nervous system, basically. They're more regulated than we are through proximity to them and relating to them and being somewhat open to the experience, being open to having that regulation happen, right? Maybe a little less defended, right? So when we talk about people giving care to us, there also has to be some ability for our body to open and take in what they're offering so that we can experience some degree of goodness or pleasure from that, right? And that's a big thing that needs to happen, and not everybody's nervous system and body has learned how to do that. And sometimes it hasn't gotten enough of that, or sometimes it's been traumatized in different ways that it doesn't know how to open up again because it doesn't trust.
That gets my nerd juices flowing so much. And one thing I'll bring up, I assume you guys are probably familiar, right, with the term mirror neurons? Like, kind of what you're reminding me of is, so for the listeners, there are neurons in our nervous system that are called mirror neurons, and literally the only thing they ever want to do is mimic what they see around them. So like when kids are learning how to speak, they're going to look at, you know, the movement of the jaw and the lips and the vocalizations of other people who know how to speak. And that's how they learn how to speak. Or like they learn how to walk, and we don't really pay as much attention to the idea of mirror neurons as adults, I feel like. Maybe in a negative context, because people will say, oh, it's harder to learn a language after a certain age, or it's hard to teach an old dog new tricks. But we still have mirror neurons, and we're still acting like a sponge with all the people who are around us, and we're to some degree unconsciously going to mimic their behavior and their patterns and their mannerisms and their whatever else and their speech patterns. But it's interesting because have you guys heard the quote or seen the meme on the internet where it says, and I feel like Dr. Franklin, you're so good at this, like you are attributing the credit for the things to the proper people, and you have named the smart people who came up with some of these different things. I don't know who said this. I'm sure it's somebody famous, but the idea that you are the amalgamation of the 5 people you spend the most time with. Are you guys familiar with that?
I have not heard that. No.
That's I forget who said it, but
I think I've heard it, Nikki.
Okay, so I'm not losing my mind.
No.
Well, maybe in other ways, but but you know, it's like.
But I think you make the point. I mean, I am familiar with different research studies that show that you know, we tend to you know, we it's easy for us to start you know, taking on certain behaviors or starting to kind of what do I want to say? You know, I'm having a hard time articulating this.
Like mirror.
Because of our wiring, right? Because we do have mirror neurons. But it's I don't think it's just because of mirror neurons. You know, it's also a lot of other things. Like, you know, if connection is part of our body's basic survival system, then relating is part of that, and that means, you know, we want to connect, right? We naturally want to connect in certain situations if it's going to help us survive them, right? Whatever that means in that situation, and so it makes it easier to kind of become one with whatever's going on between us in the field, right? Like, or to kind of get in that flow experience with other people, right? And you can tell when you're in that flow experience with other people, and you can tell when there's like a like, no, it's not happening anymore. And I think that's part of what I'm talking about with we're talking about opening up the vagus nerve. It's like when we're in that flow experience with other people, it feels really good, right?
Yeah, yeah. A therapeutic intervention could be just hang out with people that you like.
Exactly. Exactly.
Well,
and it's distraction from some of the things that don't feel so good.
Mm-hmm. Right.
Right? And distraction is a really important strategy, but what are we doing to distract ourselves? How healthful, how nurturing, how nourishing are these things that we're doing that are distracting us from the pain that we're experiencing or from the other things? And are we trying to ignore or block the pain? Are we trying to make the pain go away or having an adverse relationship with it in some way? Or are we, okay, I know there's pain and let me turn my attention to this other thing that actually can suck me in and absorb me and take me somewhere that feels good. And it's, maybe there's a little bit of escapist to it at times, but really, I think the best things that can be really helpful for opening up the vagus nerve, helping us feel good, helping us shift some of these patterns is really just trying to get into that flow experience with somebody we like, right? I mean, just have a conversation, and maybe you don't have to leave your IBS out of it, but do you have to focus on all the nitty gritty, unpleasant things that have happened over the course of the day in that conversation, right? Can you just name, if somebody says, well, how are you? I'm having a hard day, and maybe you make the choice in that instance to not go into all the reasons why it's been a hard day in favor of, and I'm not saying that you never talk about that with that person or anybody else, but just saying how you make these choices about what to focus on in each moment can really help you and, help your body to get in, a more favorable place. And the more you do that, the more regulation you're promoting. And the other is important too, but again, it's not a one size fits all. Can I give you kind of a real world concrete example of how this plays out? In my practice. Yeah. So when I meet somebody for the first time, sometimes people like to come in and they know that I specialize in treating digestive problems. And so they have this story of how their IBS began, right? I'm just using IBS as an example, but there's this story of when they first started having symptoms and what happened and what's happened since then and the progression of their symptoms. And I mean, there's a whole narrative, and sometimes people come to see us, right? And they've been living with this problem for, 10, 15 years. And so this story can be really long. And it's an important story. It really is. And it has, it has a lot of weight, right? I mean, this is a story of, how you came to come see me and why you need my help and why you're feeling the way that you're feeling right now. So there's a lot of significance to the story. I don't want to say there's not. And when I can tell that somebody's told this story a number of times, right? If you told a story a number of times, you can tell it with your eyes closed, right? I mean, you can just rotely tell the story. Sometimes it's almost like you're talking about the weather, right? It sounds like people are talking about the weather, but they're telling me this horrific story of how they came to be where they're at with their IBS. And I really try to disrupt that pattern. It is a pattern, right? If you're telling the same story again and again, one of the things that I like to do is to just very gently interrupt and say, it sounds like, I might do this in different ways depending on who's in my office, but it sounds like you've told this story many times, or it sounds like you've told this story before. And inevitably they'll say, yeah, I've told this to my doctors. I tell this to every single person I've seen over the last however many years. It's like, and then the next question is, do you enjoy telling this story? Is this doing something helpful for you right now to tell me this whole story? And I'm not suggesting, Nikki and Amy, that you do the same thing. I'm just telling you what I do to illustrate, this, this other way of really coming at it. And so, I'll ask him that question. And I'm finding that for many people, it's a huge relief to not have to tell me that story again, right? It's not a pleasant story. It does not make them feel good. In fact, they're in some cases, they're dissociated from it because they've told it so many times. It's so painful to retell it. And it's not inspiring. It's not hopeful. It doesn't end well. Right?
Right.
And so it's like, well, what if you didn't have to tell me that whole story right now? What would that be like? It's like, all of a sudden the life comes back in the room. It's like, really? Eichen has cheeseburger? I don't have to tell you that story. Like, I don't have to do that. I don't have to think about that. Like, yeah, you really don't. And so then it's like, well, what does it feel like to know you don't have to do that, right? Like, what's happening right now as you're kind of experiencing something different? And it's like relief. And I was like, great. What does that relief feel like in your body? What does that feel like right here, right now, to feel that relief? Now they're focused on something that feels better.
Right.
Right?
Right. And I think that, it's so interesting you bring up connection and how crucial that is for the nervous system in general, because so many of my clients, and I'm sure Nikki's patients, get very socially isolated the more they're down the IBS rabbit hole, where maybe they have symptoms that they're embarrassed by or that they don't want to deal with in a public situation. Maybe they don't want to eat a food that's at a party. They're doing a lot of avoidance of different situations. And I know, like, Nikki and I have talked about, like, and I even think in my own situation too, like, there were situations I would avoid. And I remember, like, sometimes I'd be like, oh, I don't know if I want to go to that party. There might be foods that I can't eat. But then I'd always feel better when I was at the party. But it was, like, exhausting to make those decisions and things like that. And I remember a specific situation too that was kind of a turning point for me. Was I played basketball all through high school, played a little bit in college, but got hurt. But I was like, I had a lot of fatigue issues with my IBS. So I was like, I don't know if my body can handle, like, playing basketball. But at one point I was like, well, screw it. I'm going to play basketball. If, like, I get tired, I'll, like, maybe play a little bit less. But I'm going to go, like, be with the team. And it was so fun. And I feel like it, like, again, lit me up in a way that was very helpful for my nervous system. I got connection. I was with friends. But there was a part of me that almost didn't do it because of, like, fear of how I was going to react, those sorts of things. And I think, like, it's such an important point to remember to have connection. And maybe, like, again, it starts with just the simple step of calling a friend you haven't talked to in a while, or it doesn't have to be like this huge gesture of, you're going to a party if that's something you haven't been to. Even with COVID, the COVID situation, like, makes it, I hope that's going to get better real soon, but it kind of complicates things as well. So I'm just glad that you brought the connection piece, because I think that it's something in the functional medicine world that's maybe mentioned somewhere, but it's not something that's discussed often or really prioritized when working with people.
And it's really, in my mind, it's number one. It's absolutely number one. We're human beings. We live, social connection is the fabric of our existence. IBS didn't get developed in a vacuum, right? It developed in the context of our lives, and our lives involve connection with other beings, and animals too, and nature as well. And, for a lot of people, God and their religion and their spirituality are very important as well. So there's all kinds of ways that connection are huge parts of our lives. And I want to come back to something that you mentioned, Amy, that I think is really important. You were talking about, how some people, they really want to talk about certain aspects of their IBS experience because they don't get to talk about that a lot, right? So when I talked about maybe, not or maybe encouraging people to not have to tell their story that they've told so many times. If somebody I was working with was not talking about something, if I knew that they had not been talking about their IBS experience or not been talking about certain aspects of their IBS experience, it would be a novel experience and probably a relief to actually feel comfortable and to feel safe enough to open up and to start talking about that with me or somebody else in their life. So that I would want to foster that, right? So it's like, what is it that person really needs? You know, their emotional needs, their social needs, needs, just needs, all in all the ways, what their need for safety, safety that, where Polyvagal Theory is the science of safety. What does safety even mean? Think about all the ways that you feel safe. There's physical safety, there's emotional safety, there's safety with, even, my personal body, my space, my safe, trusting that you're not going to invade my personal space. There's just so many levels to just thinking about how our bodies feel safe in time and space on the other end of somebody in different social situations and different contexts and, different environments. And so that's basically what I'm thinking,
right.
The way I'm thinking about it, the way I'm working with people. I'm really thinking about all these different dynamics and who is the person that I am talking to? What is their experience, right? What has their nervous system experienced in their life? And I don't need to even know the whole narrative because I can feel it in the room. I can see it relationally playing out with me, how they're responding to me, the kinds of things we're talking about, the choices that they're making, the choices they've made, right? Like that gives me a lot of information, and it's just about like, what does this person's nervous system or body need in this moment in time that's going to help them and give them the most bang for their buck so that they can experience just a little bit more ease, a little bit more goodness in the ways that we can create that right here now, and in the ways that they can create that with their family, with their friends and their lives. How do we do that? And there's just, so when you ask me for like examples, I swear, I come up with new things on the fly all the time because as I get to know somebody, I have ideas that come to my mind. It's like, oh, wait a second. So this, you really like doing this. So, well, how do we make that happen? Like, yes, you have IBS. Yes, you have symptoms to contend with. And, like you said, Amy, I really like basketball. I want to play, And so it's not like I can't forget about it. And maybe in some cases it is, right? But as much as we can, it's like, well, how do we modulate? How do we adjust? How do we not compromise to such a great extent? And fear is a big part of this, because if we're afraid, we can catastrophize. That brings up a whole other subject, like people who catastrophize, meaning they're always thinking, what if, worst case scenario thinking all the time. So like if you have a lot of catastrophizing thoughts, if that's one of your coping strategies in life, is to think that way because it helps you to survive different situations, and it actually has some value, right? Because we can prepare for worst case scenario, right? If we can think about worst case scenario, we can actually prepare for it. But when we keep thinking about what if, and there is no more preparation that we can do, that's when it stops becoming helpful. And the planning stops, and it just becomes a constant worry loop, right? Constant fear that just derails our effort to actually do something that we actually really want to do sometimes, right? So we need to work with those habits. It's about like really peeling away over the overall long-term treatment plan, from a nervous system perspective, psychologically speaking, is to start peeling away as many of these layers of unhelpful or old patterns that are not serving, or they're not serving in certain capacities. So we need to be more flexible. Like, okay, this works in certain situations, but not in these situations.
Right.
It's really changing the patterns at play, and we're not always aware of them. So we have to build awareness as well, and skills. Mindfulness skills, compassion, like there's a lot sometimes to really healing and recovering.
Yeah. And I wanted to bring up a point too, because I like the idea of safety is really interesting to me from like a food fear standpoint, because all of our clients, or typically there's a degree of food fear if you've had IBS for a while, and then they're coming from a provider that might have put the fear of God in them if they eat these no foods.
Right.
They're, again, like the catastrophizing, Yes. I remember personally, like, I thought if I had a Brussels sprout, like I'd implode or something. So I think with the food fear scenario, it makes foods not safe, which like inherently would probably send your nervous system to be dysregulated, like we've been talking about. And I think like,
I think it's interesting. Actually, can I tease that out a little bit? Because you're so right. And this is where, people get really stuck and they get really frustrated, and it just spirals into a place of, a deep, dark hole, really. And I think, it's almost like the fear of the food becomes fear, can become fear of eating.
Right.
And it just really gets in the way of enjoying such a huge part of our lives, right? I mean, we eat multiple times a day, and we need it for sustenance, and it is enjoyable in many ways. And when it stops being enjoyable, when the whole experience stops being enjoyable, that's really a hard thing, a very hard thing to live with.
Right.
And so if you the way that I tend to work with that is to and this can't always happen early in the healing process, because you have to have enough bandwidth. Talking about the window of tolerance, I mean, we've got to deal with some of these bigger things before we can actually start. How are you going to address fear of food when your whole nervous system is just in general riddled with fear, and everything is a what if, right? Everything. Like, we have to start kind of chipping away at that layer by layer and get to a place where there's enough resilience, there's enough ease in the system, there's enough regulation that somebody could actually handle trying a food that's on their so-called no list, or even talking about. I mean, there's some people that are so activated by just talking about food. I mean, how far can you get when just talking about food is so dysregulating, right? Like, they just shut down.
Yeah.
Do you know what I mean? So it's like, how do we focus away from the things that are dysregulating and towards the things that are regulating? Or if they're not regulating, they are benign. They're not going to be dysregulating instantly. Right. So it's like this, not that I have this checklist in my head, but it's like, where's the flow? Like, I mean, you can tell when you're working with someone, you're like, oh, we're in a good place. They're smiling. We're relating. Everything's good. We're making jokes. We're laughing. Like, we feel good. And then, I mean, I'm constantly checking in with people, and we're like, how are you doing? Like, how are you feeling? Or I just know them. And so I kind of I get to know people over time, and I get to know, I can tell. And so, and I'm not saying that we're not focusing on the important things that we need to talk about. It's like, it has to be done in a skillful way so that it's helpful and not just overwhelming people, which is re-traumatizing essentially on some level.
Yeah. I think it's interesting too, because you had mentioned that even eating in general then becomes traumatic. And I even think like the physical, like, I have a lot of undereaters. I know Nikki has too, where like then there's a literal physical stressor if you're not getting nourishment from food, which is going to be dysregulating too. So a lot of times, like, if I see that, it's more like, what kind of foods are you most comfortable with? How can we increase those at this moment? And then, eventually end goal is to broaden up diet. But yeah, I think it's interesting.
How could you, I'm just curious, like where my mind goes as you're talking. It's like, what what could help somebody to have a more positive experience of eating, and to focus less on the what and more on the how and the atmosphere and the context. Like,
Right.
Is it different for you when you eat? Are you this fixated on what you're eating and how much you're eating and all that stuff, with different people? In other words, do you just generally feel more at ease eating these foods because you just generally feel more at ease eating? Are you distracted? Are you so distracted by conversation that you're not even really thinking? I mean, maybe that's, I hate to recommend like mindless eating. I'm not recommending mindless eating, but like, you know what I mean? Like we've got to find clever ways to help people to feel good, like just generally good, and not sustainably. It's not going to be sustainably good, like 24/7, every moment of every day. Good. I'm feeling good. I'm feeling great, or I'm feeling, and it's also, I mean, it's really nuanced, because it's not, it's also not good, like going to Disneyland. Good. You know what I mean? Like, I think that comes into play when I talk about this too, because people are thinking, well, how the heck am I going to feel good? I feel terrible. So it's not, we're not talking about extremes here. We're talking about like, how can you have a moment, just one moment of feeling some degree of pleasure? Just, the tiniest little thing that makes you feel like, I can breathe again for this moment, right? And then we just want to build on that and stretch it out. And we have to, if you're, a dietitian or nutritionist, right, then that's what I would be thinking about. It's like, what are all the ways that I can create that kind of experience, or make suggestions that help people have more of those experiences? Because the more of them you have, guess what? It's more of this relief throughout the day, right? It's not just once. It's like, oh, that feels good. I can breathe again. Oh, maybe I can breathe again for like 5 minutes. Maybe I can breathe that way for 20 minutes. Maybe, it's just we build and stretch out and keep repeating. It's a lot of that.
Yeah.
Like that. It even brings to mind like something maybe simple that people could do is, I'm thinking of little things like get some flowers to put on the table and like make your dinner table look pretty, or like
Yes.
The weather is nice now this time of year, like maybe eat dinner out on the back porch if you have like a table and chairs.
Yeah.
Or
music, right? Music that makes
yep.
you feel really relaxed. Maybe you take a little walk out in nature and kind of prep yourself for, just kind of get yourself, or maybe take a bath before you, like I could come up with a million different things depending on what's going to make what, I could just list 1,000 things, but that's not helpful to that person necessarily, right? It's like, what floats their boat,
Yeah.
Mm-hmm. Well, and I think that like meals and eating too are a vehicle for connection in so many ways too. Yeah. So if you're like so freaked out of food, or going to a restaurant that might have foods that you're nervous about. Yeah. And I find it's interesting too. Like, I just talked to a client who was like, oh my gosh, like, Amy, I went out with my husband. We had an amazing time. Like, she's like, you won't believe, I had churros and I had beer and was like totally fine, So she was like all excited about this experience she had. And so, like, we were talking and I was like, you should try to do that, like, at least maybe every other week with your husband, to, like, go enjoy food, like, not worrying about, and again, she was probably one of the types of clients that was ready to reintroduce and try different things, which I think, again, the more we can support that, the better. Yeah. But, like, I love those experiences where, like, they're, like, getting out of their normal day, right, able to connect over a meal, and they react way better than they could have thought. Right.
So what you're talking about is safety, right? Like, you feel safer in your body, and part of safety is trust. Like, we can build a sense of safety, kind of like they go hand in hand, right? I mean, how do we feel safe with people, and then through one experience of safe, we might start to trust them a little bit, and then another experience of feeling safe with them, we might trust them a little bit more. And that's kind of what we need to do in our bodies. We need to have a little bit of an experience of safety, and then build trust over time, right? So we start with one bite of a food that we're scared of eating, right? At a good time. not when you're stressed out about something else or you know what I mean? Like it has to be thoughtful. You've got to plan for this and make sure that you're in the right mindset and set up the conditions, right? We talked in the beginning, we talked about setting up the right conditions, right? So we want to get the flowers, all the things that make an enjoyable eating experience for you. And then you take, your little step, a baby step, right? Sometimes things have to be dialed down to baby steps. You take one bite of this thing that you really want to eat that feels really scary for you, right? One bite. And one bite is, for most people, and you can correct me if I'm wrong, Amy, it's not going to make a huge difference, right? Right.
No.
So unless it's an anaphylactic allergy, in which case do not eat one bite of peanut butter. That's the one exception.
Anaphylactic allergy, right?
Then please God don't.
One bite. But that one bite, can you bring mindfulness to that one bite and savor every moment of eating that one bite? Do you know what I mean? Like really slow that down, savor it, milk it for all it's worth, enjoy the heck out of it. And then, you also have to work with really surrendering, what if we got to work on that so that you can let your body digest, right? Let your body do what it is going to do. And it's kind of like, I don't know how you work, Amy, but I find it to be a lot of kind of gaming a little bit at times, right? It's, it's kind of, whatever will be, right? Mm-hmm. Hey, sarah, it's, okay, I'm willing to take the risk of eating this one bite. And it's one bite. I've trained myself for this moment. And most likely, you really have to believe this, most likely everything's going to be fine. And you can do that when you've built trust again with your body because there's safety. Right. So, yeah.
Yeah. And I think so much, unfortunately, there's so much noise out there of diets and supplements and what you should be doing and shouldn't be doing that a lot of people are so disconnected with what their body truly is saying or needing or yearning for. So it does become about learning to re-listen to your body again because it's been so noisy with everyone telling you what you should and shouldn't be doing that it's hard to pay attention to how your body is responding, especially with food. I mean, you'll talk to people, Nikki and I have talked about this, where it's like, oh, I never had a problem with onion before, but it was on that list. And so it's like, well, maybe your body does just fine with onions. We should add those back in. But yeah, I think the disconnect from your body is such a big one from the clients that we have.
Huge, Amy, huge. So, I think I came up with a little catchphrase, not in this moment, but I came up with it a little while ago. But it's basically attune so you can attend, right? We need to attune to our whole selves in the ways that we're not already attuned to, right? That's it. It's opening channels that we're not paying attention to. And that's where the change and the healing is, right? Or if you're already attuned to things, what are you doing with that information, right? It's attuned so you can attend. So attune to what's happening, and attending is doing what needs doing, right? Doing what needs doing what wants doing.
Yeah, I love that. I wrote that down. Don't mind if I use that. I'll quote you.
Thank you. I'm glad it was helpful.
Yeah.
Yeah, I think a lot to chew on. It's almost deceptive in its simplicity, in a way, what some of this boils down to.
Yes.
Do things you enjoy. Hang out with people that you like, who don't stress you out.
It's so funny you should say that because, I'll tell you a story. This morning, I was telling my son that I have to start working on my next webinar series. And he looked at me and said, well, why? You just finished yours. And I said, well, in this webinar series that I just finished, I told people, what they need to know in order to heal their bodies, right? I gave them the education that they need to have in order to start healing. But what I didn't tell them is how to start healing, right? Because if I came out and actually said these things up front, like, oh, just focus on what feels good. I mean, that sounds so callous. It sounds so invalidating. like, oh, just focus on what feels good. You know, I know you're feeling bad, but just ignore that. I mean, that's the way it's going to be interpreted. And that's not in any way, shape, or form what I'm saying or what I'm intending to say, right? It's not that at all. It's shifting your orientation, shifting the way that you're thinking about things a little bit, just a lot of little shifts that add up to a big ripple effect over time.
Yeah. And I think it is like, there's so many ways that, I mean, with social media and screens and like, there's so many ways to disconnect in general that like, it does seem so
and
simple
get overstimulated.
Yeah.
And get overstimulated, right?
Right. So, I mean, I think that there is so many ways that like modern life's distracting. So it like seems simple, but it's hard. Like I find like even talking about, which is in the same vein, like different stress management approaches are going to be regulating, but Nikki and I talk about, bringing up stress sometimes is invalidating because they were told by their doctor, oh, it's just your stress, or
right.
like, oh, you're just stressed. But it's complex. I mean, there's different aspects to it. It's not just like you got to chill out. That's not a helpful thing, but it does. I think there's a lot of complexity in ways to get dysregulated. So figuring out ways that help you stay regulated, I think, is really important, even if they are really simple.
Right. I mean, and what you're saying is, stress is a normal, natural thing that our bodies do.
Right.
In response to all kinds of stimuli, and we cannot just separate ourselves from the world without completely isolating, which is not good for us in other ways, right? Or not working, not doing the things that we need and want to do, right? So if we're going to live life in any capacity, there's going to be some stress. And so what do we do with that? How do we work with that? And that's what, that's basically my approach in general, is that working with the nervous system, working with your body, not against it.
Mm-hmm.
Yeah, well, it makes the healing a lot more pleasant, if not more effective. If nothing else, it's going to make the journey a lot less tedious and awful feeling. But yeah, I think, to that last point, we've talked about this before, that I think a lot of people get kind of triggery when the topic of stress comes up, because in the conventional medicine space, bless their little hearts, it's this very like dismissive, judgy thing of like, you go to your doctor or your GI doctor or whoever, and they don't have answers for you. And they're just like, you're probably just stressed. Here, take Lexapro and like get out of my hair. See you never.
Right.
And it's like, it's an excuse for them to just give you a prescription and boot you out of the office. So enough people have experienced that then when another person brings up stress, it's like they're reliving that trauma, and they're triggered and they get more stressed, and then they're like, no, I'm not stressed, damn it, there's something going on.
Right.
It's like,
yeah, I know. There's a lot of defensiveness about it because it comes across as so invalidating. And like, even hearing you talk about this example, it's just like, honestly, it hurts. It hurts me to hear stories like this. It hurts me that health practitioners are perhaps, saying and doing these things that are truly hurtful. I mean, they're hurtful. It's to be invalidated, to come to somebody it's automatically a little bit deferential to go to a doctor or an authority figure, somebody that you're entrusting with your care to some degree, tell you that, something, to give you any impression that you're doing something wrong, that you deliberately caused this or caused this in any kind of way, or that your experience is not really valid in some way, or that it's not true, that it's not real. There's just all kinds of ways to invalidate. And it's just, I think that's why polyvagal theory is, I really wish that all healthcare practitioners were getting some training in polyvagal theory and understanding what safety really means and how to practice that. I think if that actually happens systemically, I think the way that medicine is practiced would have to change, like, dramatically, because the conditions that medical practices are most medical practices are operating these days are not conditions under which even the practitioners themselves can feel really safe and good.
Right.
And it's really sad. It's really sad. And it really frustrates me, honestly, because I think it's causing like a level of systemic harm that is so under the radar. It's not even detectable. And we've come to expect that that's how it's going to be. We kind of just tolerate it, and that's the way it is. But it doesn't really feel good to our nervous system, to the part of our bodies that's like really wanting connection and really wanting to, like, be received, be welcomed, to feel really, heard and seen and not judged and not criticized, and, to really validated and just good. All of these things are the things that I really try to do, especially during, this is pretty much all I'm doing the first session I meet with somebody, because I think just doing that is novel. I know it's sad, but it feels like, I can see, right? I can see them light up when they're like, oh, I don't have to tell my story, or, oh, you're going to like really walk, you're going to give me time to like go to the bathroom. You're going to like let me leave in the middle of my session and, not take offense to my having to run to the bathroom, or, whatever it is, that it's like, it's all okay. It's really okay, for me to take care of myself, for me to really say what's true for me, to really be myself. It's really safe enough for me to do that. And, we just don't kind of live in a society where we're trained to do that, a lot,
Yeah.
Well, and even like, to kind of go back to a former point, when I brought up that idea that you're kind of the amalgamation of the 5 people you hang out with the most. Like, you're the 5 people you hang out with the most, friends, spouse, your children, your parents, whoever. Do they make you feel safe? Do they make you feel heard or validated? Mm-hmm. Or are they dismissive or judgy or snippy? Or do they have, or
do they just skip over? A lot of people just skip over it. Like, they go straight to fix it. Let's fix the problem that's making you upset right now. So they actually mean well, and they might even have the skills, but their brain gets stressed by seeing their loved ones stressed, right? And then they just want to, help them solve the problem, because that's what our brains want to do. Like, really, our brains kind of naturally want to do that. So we actually have to slow down and remember that we need to attend to their nervous systems first, right? We have to slow down and just connect first. Then we can do the problem solving later, once we connect, and just let everybody take a breath and slow down, because I'm here with you. Everything you're saying makes perfect sense. I'm so glad you're talking about this. I'm so glad you feel comfortable talking about this with me. And I'm good with what you're talking about. Like, I'm really okay. I'm not rocked. I'm not going away. I'm right here. Like, we can just be here with whatever you're feeling, and we can deal with this together. You're not alone.
Yeah.
You're not alone. Right? And then once people get that in whatever way, and sometimes it has to be very explicit, and sometimes it, with somebody whose nervous system is a little bit more, ready to move into connection in that way, you might not need to make it so explicit. It sure is nice to hear sometimes, right? And then it's like, okay, I'm feeling a little better already, just knowing that you're here and just being able to talk about this. And okay, I think what do I do? Here are all the different pieces, because then the brain can start to really see much more mindfully the whole picture. It's not just reactive. I'm just with this one feeling. This one feeling is just getting all of my attention. It's so big, I can't see past that. Now it's like, well, actually, there's a few other feelings here, and the situation is actually a little more nuanced, and maybe I can see their perspective. And it just changes everything, right? Now, all of a sudden, we're more resilient, we're more mindful. We can just deal with the situation a whole lot better.
Yeah.
No, I think that's a good point. And I'll point this out too. I don't know if this is perfect. I was thinking of it a little bit ago, and I don't know if I have the timing quite right, but another thing I want to point out too, in the context of like your relationships and the people you spend time with and what you're kind of absorbing and being a sponge of, is I find a lot of my patients, and I think, Amy, you're going to agree with this, that probably a lot of your clients spend an awful lot of their time in these like Facebook groups that are, multiple.
You see my face.
Yeah.
This
Multiple.
is not good. This is not good stuff sometimes.
Thousands of people with SIBO, or
Yeah.
thousands or tens of thousands of people with IBS or Candida or whatever it is, and talk about something that makes people completely stuck, completely terrified, and they're absorbing that, oh my God, we're all doomed energy. Like, that's one thing that I tell a lot of my patients, especially if they talk about their Facebook groups and they bring it up. Like, I tell a lot of my patients, I recommend that you either leave those groups, or if that's too big of an ask, unfollow them. Like, in a Facebook group, you have the option to unfollow it so that you don't get notifications and it's not in your news feed, but you're still a member. So if you want to go in the group and specifically look for one thing or specifically ask a question, you can. But like, I really think those groups do more harm than good, honestly, for the vast majority of people. Everybody goes there hoping to find the Holy Grail, but it turns into this environment of a lot of people who are very dysregulated. And I think being around those people who are dysregulated makes you more dysregulated. And they're all understandably desperate for answers, desperate for solutions. And it's a really wild and not healthy place to be oftentimes. I like it conceptually. Like the idea of people banding together and,
we're sensitive. I love, one of my favorite things that people say is, I'm sensitive, right? Like, I'm a sensitive person. We're all sensitive people. We're wired that way. I mean, we really are, right? And, that's part of our nervous system's wiring for survival, right? We have to sense danger. And so we are sensitive to our environments to be able to do that. And so if you are in a certain environment and there's a lot of people that are, either fear-mongering or just talking about really scary stuff, we have to attune so we can attend, right? So what is happening? Like, go to the Facebook group and study what it happens for you. That's what I would recommend. If you're doing something and you're not sure how it's affecting you, study yourself, study your experience. Notice what's happening before you do the thing. Track yourself as you're experiencing the thing, like right as you start, check in with yourself periodically. I mean, I sometimes give people an exercise. I mean, this is kind of a very general exercise, but this is an awareness building exercise to kind of check in with themselves multiple times a day. And sometimes I tell them to set their timer to go off every hour over the course of one day, every hour for one day. And every time their alarm goes off. And I modify this depending on which things people need to work on. But, it might be, notice what emotion you are feeling right now in this moment. So every hour, it's what am I feeling emotionally right now in this moment? And it's really an interesting exercise, because often what people say is, wow, I go through a lot of emotions over the course of the day, right? A lot of different emotions. And I think that, we just need to pay attention to what is happening in a more moment by moment way. That doesn't mean every moment. We cannot be mindful 24/7. But in certain isolated incidents like Facebook groups, if you're trying to decide what to do, do I stop doing this? Is this harmful? Is this not harmful? We need to slow down and develop some skills sometimes and cultivate more awareness and just, use these skills to study what our nervous system is doing. It's not just what we're thinking and what we're doing. It's what's happening inside of our bodies, what's happening sensationally, what's happening emotionally. What is our autonomic nervous system doing? Are we feeling more stress? And you can track that in different ways. Or am I feeling more stress or less stress? And as you get to know your body, you start to know different sensations and emotions that might tell you that, right? And so then you can start to track that in different social situations or Facebook, right? Like what happens for the first 5 minutes? Oh, I'm kind of fine. I feel fine. I feel good. I feel just the same as I did before I even got here. And then all of a sudden this one person starts, saying something, or I read this one post, and all of a sudden, I'm just gone. I'm gone. I'm totally stressed out. I'm totally terrified. That just pushed some button in me that made me get really activated by stress or traumatized, just opened up the can of worms and re-traumatized me. And then there you are in, totally dysregulated again.
Well, and I think even one point I want to make too is that one of the reasons why I have a lot of people unfollow the groups is I think that one of the things that makes social media, especially Facebook, really tricky and hard to gauge how it makes you feel is because it's such a mishmash of so many different things. You're seeing posts from your best friend in the entire universe, your great aunt Mildred, who you haven't talked to in 800 years. You're seeing advertisements from companies trying to sell you a bunch of bullshit. You are seeing posts from your IBS group, your SIBO group. You're seeing posts from the I Love Squirrels group. It's such a weird amalgamation of everything. And I think it just kind of cleans up the news feed and it cleans up the experience and it makes it clearer, what is helpful and what's not. If you can keep the news feed just the people you actually like. I think, unfollow everybody else.
I think you're making a valid point, a very valid point. And I think that's true for a lot of things. We could talk about Facebook, you could talk about eating, you could talk about a lot of these different aspects that relate to IBS and say that the general, one of the general strategies is looking at the how. How am I engaging with these things? How am I doing this or that? It's not as much about the what and more the how. And and in my book, it's a lot less about the why and much more about the what is, right? Not why am I experiencing this? Why do I have IBS? Why am I having IBS right now? Why is this happening? Why is that happening? The why just leads us to a lot of, cortical thinking, right? Analyzing, that kind of left brain, strategic, critical thinking. And that does not actually usually solve the IBS problem, which is why people get frustrated, right? And there's, if you've asked yourself the same why question again and again and again, and you're not getting a different answer, it's probably a more helpful strategy to shift to something else where you can get some results, right? And what is much more helpful in a lot of situations. What is, not why is this happening, but what is actually happening right now in this very moment for me, right? In the ways that I can sense and opening up the awareness so that I can really notice what's happening right now for me and what can I learn about myself in this moment? What can I learn about the way my body responds to this environment or this situation or this whatever? Right? What can I learn about the way my nervous system navigates through the world and through relationships that can help me to better work with it?
I like that.
You gonna write that one down, Amy?
you should see my little bulletin board. I have like all these, not sticky notes, but they're like little chunks of yellow paper that are plastered all over of like little nuggets that I've taken away and I'm reminding myself of. I think we have a pretty fair amount of good golden nuggets on this podcast, if I do say so myself. Being half of the core crew. Well, gosh, I just dubbed us the core crew. So guys, where, I feel like, honestly, Dr. Franklin, we could pick your brain all day if we could. I already will vocalize an opinion that I would love to have you on the podcast again in the future. But for the sake of starting to wind down on this podcast, is there anything else that you wanted to mention or address? Or do you have any like big takeaways or, anything that you want to add in before we start to wrap up? Because this has been just so great. And I hope all our listeners listen to this one twice because it's been so good.
First of all, thank you for saying all of that. I'm glad that you feel there's so many takeaway nuggets from this podcast. And I love talking about this stuff. This has been the focus of my work for 20 years. And for many years before that, the focus of my personal life, because I was trying to help my body to heal. And I wasn't doing it so deliberately, but it was there in the background. Like it was always, kind of something that I was mindful of and thinking of, because I was trying to navigate life with IBS. Right. And so it's just so lovely to be able to talk about this with you guys. And, I'm really happy to come back again. And,
yes.
And I do, I don't want to like overly plug the webinar series that that I've just launched, but
I was going to plug it again for you. You go first.
But yeah, but I just want to say that like the reason I did that is because, I had been giving a 1 or 2 hour talk to people, and it was way too much information in such a short amount of time. And so this stuff is really, like I said, a lot of this polyvagal theory stuff and really understanding the application of it. It took me years to really understand it deeply and how to really work with it with myself and with other people. And so, I broke all of the material down into, 5 parts, 5 webinars, 5 hours of material. And there's some review in there too. So it's not 5 hours of new material. It's, 1 hour with a little bit of review. And I feel like it's better paced, and I feel like it's going to really help people to learn, which is my goal, is to help people learn this stuff so they can start to go to their therapists, and they can go to their dietitians or nutritionists, or they can go to their practitioners, their medical practitioners, and they already have an understanding of this, and they can start to, they might not be able to talk to their practitioner about polyvagal theory and whatever, but they can at least know what feels good to them and what doesn't, and kind of ask for what feels good, more of what feels good, and shift the focus away from what's not feeling good, right? Rather than waiting for a practitioner to say, maybe you don't need to tell that story. Maybe they don't even start with that story. Maybe they condense it down, and, maybe there's just a different dialogue that happens, which in and of itself would be really helpful.
Yeah.
Yeah. And I think a lot of this stuff too can be a part of everyday life even, I would say. Like not even just take this with you to your practitioner or your therapist. Like literally some of the stuff you can start doing today and start bringing some awareness to it and start making little changes and shifting your focus, like you said, shifting away from things that feel bad or yucky, and just starting to shift your life towards things that make you feel good and safe and happy and fulfilled and connected and excited.
Right. I hope it goes without saying, like, absolutely. Yes, we absolutely need to inject our lives as much as possible with all of those things, and use it in all different contexts. Yeah.
And I have something to share. And I think I've mentioned this a couple times on the podcast. I poke fun at it moderately frequently, so Amy will crack up. So I don't know if this will make you laugh or horrify you, but so Dr. Franklin, every episode or so, I like to throw a little bit of shade at my own profession and just kind of chuckle at functional medicine. Like, usually it's well-intentioned, but sometimes it's laughable. So one of the big things in the functional medicine space right now is talking about the vagus nerve. So that's cool, right? Like, go you guys, this is a big deal. But the way it's discussed cracks me up because, I don't know if you're familiar with this, supposedly the way to stimulate your vagus nerve is to gargle vigorously until you tear up. And you have to do that every day to get your digestion working again. And I'm just so blown away every time I see that perpetuated in another summit or a forum or whatever. And I'm just like, I don't know if I should laugh or cry or scream because I'm like, okay, neurologically, like I get, you know, like the neurological pathways and the part of the vagus nerve that innervates the back of the throat. Like I get that part of it. But guys, like we're talking about this beautiful, big rest and digest safety nerve. And there's no way that gargling vigorously until you cry is going to make you feel safe and fulfilled and happy. Like, it's preposterous. So I lean more towards I laugh at it now, but I truly don't know if I should like laugh, cry, or scream when I hear people talk about, oh, just gargle vigorously until you cry every single day of your life. And that's how you get good digestion because you promote the vagus nerve.
Yeah. I mean, I think it's interesting. I'm not horrified by this because there's some exercises that I've been trained in that are probably along the same lines as that. And I think a number of those strategies, the vagus nerve is how the brain and gut talk, right? There's this, it's basically, you know, a communication system. And so doing some of those things can disrupt the communication pattern a little bit. It's like creating a little hiccup to create a pause, you know, a disruption so that something else can start to happen, right? It's kind of like a break in the pattern. So, I mean, I think that has its use, you know, but
well, I guess my point is it's not the singular solution.
Right, exactly. And not without a focus on these other things too. It just seems like it's always the next hot topic that becomes the focus. Like, you know, just do this, just do that, just do this other thing. And things will start working better. And, you know, and that's just really overly simplistic and reductionistic. You know, the truth is that everybody's a little bit different. Everybody's nervous system, you know, yes, there's a lot of commonality, right? Our nervous systems are wired in a particular general way, but our experiences through life then teach our bodies certain patterns. And that becomes very individualized, right? What floats our boat can be very individualized. It can be general, and then it can be very individualized as well. And so we kind of have to keep this balance constantly. Like, yes, we need to do more of the gargling maybe, and you know, if it's helpful, right? And a lot of this is trial and error. So you try that and see how it works. Is it the one thing that's going to make the biggest difference? I don't know. You know, is there one thing that's going to magically fix your situation or change your situation? Probably not. But maybe if you're just, you know, one of the very, very lucky ones. I mean, I literally have never seen that, but I don't want to say it's not at all possible because I guess anything's possible.
Yeah.
But you know what I'm saying? It's constant balancing act. It's constantly really being, you know, thinking about what, you know, I'm not saying you have to think about this in every single second, but overall, you just want to try different things and see how that works and abandon the things that don't work and keep doing more of the things that do. And then maybe add something that feels like the next thing that you want to try. And that could be going to a different practitioner. It could be trying the tiniest little shift in your behavior, or trying something new, or trying a new food, or, you know, doing something different internally. Like usually I think this thought, but I'm going to shift my focus over here. So many things.
Yeah, I think, I would just say that, like, I conjure up the image now, like with the gargling thing. I'm conjuring up the image of, like, somebody who's really stressed and, like, hates their job and is so busy that they can't take a lunch break at their job, right? Because, like, they're totally busy and they don't prioritize a lunch break. And maybe they have, a bunch of food fear and deficiencies, and then, for the internet in some way to suggest to that person, like, oh, just gargle. It's like, well, if you're doing that one thing, but you're still like 10 out of 10 stressed, and you hate your job and you hate your life, and like you're terrified of food. Right. No, I'm sorry, gargling is not going to be the end all be all that cures you. But like you said, it might be that that's one of the tools. Like I've talked about it before. I'm not sure if you're familiar with this, but you can get, you can use a TENS unit to stimulate the vagus nerve too, the auricular branch of the vagus nerve. And you can get a TENS unit with these little ear clip dooley bobs. I don't know if you can see that properly, but you clip that on the tragus of the ear, and that will do actually a pretty reasonable job of stimulating the vagus nerve. But I never, ever send a patient home with a TENS unit and an ear clip without the conversation of stress and like trying to facilitate vagal tone through other means. It's just like, this is a really quick, efficient way to get some improvement in vagal tone. And it's nice because usually people can see a difference within the span of like a day or two. Yeah. But like, you don't get this conversation in my office unless we are also talking about stress and mental health and how you're going to improve that piece of it. Right? Because otherwise the TENS unit becomes a Band-Aid. And like, what use is that?
Right. And if the goal is to, my goal is to help people to regulate their nervous systems, because when you have a well-regulated nervous system, digestion just functions better, right? On its own. That's what happens. And so I'm working with the nervous system and helping to facilitate regulation. And one of the assessments, one of the assessment pieces is, has there been regulation in this person's nervous system, in this person's body? I'm sure everybody has, the capacity for regulation, and everybody's had the experience of regulation, but did they have that experience consistently early in their lives, right? I mean, did they have the kind of family system where the kinds of parents that were really present and calm and centered, and were there no like major traumas that kind of, there's just a lot of different factors that go into that. But the bottom line is, did they have enough regulation early in their lives to actually set their bodies up with some degree, some window of tolerance, right? Some capacity to then build upon and develop such great regulation over time that there's actual resilience and there's there's real regulation happening as an adult, right?
Yeah.
IBS in the context of that is very different than IBS in a body that has never known that, right? And then we have to, then the treatment's the same. We need to facilitate regulation, but, treatment for somebody who's never really had a well-regulated nervous system and body to begin with, like ever, then we have to really work a little bit differently, because then attachment might be really important. So then the relational work becomes much more important than maybe going out in nature and just spending time outside and finding ways to self-soothe. Maybe that's very helpful for somebody who already has a fairly well-regulated nervous system, and maybe they just need some trauma processing because they had an experience that then made them get dysregulated. You know what I'm saying? Like there was regulation, and then something happened, they got fairly dysregulated, and then now we need to heal, but we know what we're working with. That's, I think a lot of people kind of assume that that's what it is. But much more often than I think people realize, it's more the former, that there really hasn't been a lot of regulation enough and that this dysregulation has been going on really a long, long time. And when something's been going on a long, long time, you adapt to it, right? So we learn how to live with that, and we don't even register it as dysregulation. It's like, this is just the way I am. Like, even personality traits, like I'm just a really, high intensity kind of person, and, I've come to learn that personality and trauma, like, it's kind of hard to tease that out sometimes, because behaviors that we see, go along with personality. But what if the behavior is really a function of trying to manage constant dysregulation?
Yeah.
I have nothing to weigh in on, just, again, kind of getting the mental juices churning.
Yes. I know.
No, I think that's accurate, though. I think that so much of what we call personality can go back to how your body is responding to dysregulation or trauma or stress.
Right.
And your resiliency or your flexibility in those moments. And then we're seeing that and we're calling it personality, or we're calling that behavior.
Right. And so if we really want to help the body to have, more normalized or better digestion, right, then if we focus, I'm not saying we exclusively focus on nervous system regulation, but this is my focus, right? It's regulation. How do we get the body regulated? What needs to happen? And if this has been a lifelong pattern, then we have to do a lot of consistent regulation work, right? Because how do we learn? Through repetition. So it's a lot of repetition of small little shifts over time.
Yeah. Well, it's kind of like you're trying to groom new pathways,
It's exactly what we're doing.
Yeah.
Well, I know. Sorry. I hope I'm not overwhelming you.
No, you're not. We're just taking it in.
There's so much. There's so much to say on this topic. There's just.
I feel like my brain is full, but it's like full in a good way. It's kind of like after you go to a buffet and you're like, oh, I'm so full, but it's like, I'm happy about it.
Right.
Kind of I'm full. I feel like I'm having that sensation, but it's more in my brain. Like, okay.
I hope your audience feels the same way. They might feel like that this should have been broken down into 3 parts or 4 parts.
Well, we'll just have you on again. That's the easy solution to that. But if you guys want more of a deep dive and more of an understanding, I mean, you can listen to Dr. Franklin talk about this stuff and the polyvagal theory and some of the application in her webinar series that's out now. So, I mean, if you guys are like, man, if only this podcast was another 4 hours long, have at it. The URL, I challenge you to forget her URL, don'thateyourguts.com. It doesn't get better than that. I crack up every time I type that in because it's so perfect and descriptive with like a little bit of wit and humor. But yeah, I mean, I think I'm really looking forward to the webinar series, and I'm going to register for it myself because I think, some of it's going to be applicable to me, I'm sure, because I'm a human with stress and dysregulation in some way, I'm sure. And I think that there's going to be nuggets that change the way that I practice with my patients. So I'm really pumped for it. I'm going to sign up for it. And I hope all of you do as well. And then, like I said, Dr. Franklin has a YouTube channel called Don't Hate Your Guts. And then I forget, are you on Instagram or Facebook at all, Dr. Franklin, or is it more so your blog and your website and then your YouTube channel now?
I have a Facebook page. It's Don't Hate Your Guts. And I do have an Instagram account for Don't Hate Your Guts. But honestly, over the last year and a half, with everything that's been going on in the world, I have not really been doing much on those sites. But hopefully that will change soon.
Okay. Well, you can give her a follow at any of those places, but definitely check out Dr. Franklin's website, don'thateyourguts.com, and the information for the 5-part webinar series is up there. There's a tab for webinars, and then check out her YouTube videos, because I've sent a lot of those to my patients since you launched your YouTube channel, and there's some really great gold nuggets in there as well. So I can't thank you enough for coming on the podcast, Dr. Franklin. It was absolutely marvelous. Like I said, I feel like my brain is full, but in a really good way. like my brain went to a buffet and I need to kind of like marinate on this and chew on it a little bit, and then
like Thanksgiving dinner.
Yeah, exactly. Now I need to like process a little bit and digest it. But just so much great information. And like I said, everybody, I hope you listened to this episode twice. It was so good. And as always, you can find other episodes for the podcast on YouTube. You can find us on podcasting apps if you want audio only. We do have an Instagram page, ibs.freedom.pod or podcast. I forget which.
Podcast, I believe.
All right, there we have it. We have it, folks. We have an email address. It eludes me at the moment, so don't ask me what it is. And then if you have questions, drop them in the YouTube chat or email them to us if you find our email address, because we do Q&A episodes every so often. So holler at us. And per my usual, if you could rate us 5 stars in the podcasting app of choice, or if you can share this episode in one of your SIBO and IBS groups, even though I kind of talked harshly of them earlier. But if you could share this video in some of your groups online and help us reach the people who need this information the most, that would be deeply appreciated as well. But Dr. Franklin, thank you so much for coming on the podcast. It was an absolute joy, and I look forward to picking your brain more in hopefully the near future.
Thank you so much for having me. I look forward to more later.